Hi, everyone. Good morning. My name is Racine Droz. I work with City Harvest. I'm the Senior Director of Safety and Emergency Response, and I co-chair New York City VOAD with Zach Hodgson and our Vice Chair, Io Harrington. So thank you everyone again for joining us. We really appreciate it. So for today, we have some great discussion about heat mitigation, awareness, and what has been done for advocacy. So I just want to quickly introduce our three guest speakers. So we have Christopher Pagnotta. He's the Director of Human Services at New York City Emergency Management. And he'll provide some information on New York City's cooling centers and guidelines on how to establish one. We have Katherin Sibel. She is the Community Climate Resiliency Coordinator at the Department of Health and Mental Hygiene, Bureau of Environmental Surveillance and Policy. And she'll be sharing some insight on the impact of heat, best practices for planning and preparation, and the policy work undertaken to mitigate its effects. And we also have Caleb Smith. He is the Environmental Science and Policy Resiliency Coordinator at WEACT. And he'll discuss their efforts in climate justice and awareness, offering some valuable insights and tips on how we can support these initiatives. So without further ado, I would like to start off with Katherin, who will kick off the presentation for today.
Buenos dias, everybody. I'm just gonna set up my screen here. Can everybody see?
Yes.
Yes.
Amazing. Hi, everyone. My name is Kat, and I work for the Department of Health and Mental Hygiene. And today I'm going to be talking about community heat health and safety. So thank you for inviting me. I hope you find this information helpful, thought-provoking, any of the above. So I'm looking forward to hearing your thoughts and where you can take this info in your communities and your work. Further ado, so we're here because New York City has some climate hazards out there. As we all know, we have flooding, inland flooding, tidal flooding, coastal flooding, but we are amidst a heat wave. So that would be extreme temperatures, which is what we're focusing on today. And moving forward, just so you have a sense of the flow of how this presentation will go, I'm really going to talk about why is New York City so hot. My team at the climate health team, in particular at the Bureau of Environmental Surveillance and Policy, they're epidemiologists that study how climate change impacts health. And with that, a big part of this discussion is the built environment. So just wanted to show some data tools and how that overlaps with heat, but then also with equity. So then we'll get into the heat adaptation and then also the more technical info, such as how to spot heat illness. Just going over that, maybe you've heard it before, and if you have, you're going to hear it again. So that way we're all experts and we're ready to go when we're out there. And sharing a tiny bit of different strategies and resources as well, as a reminder. So I think the number one, maybe not number one, but a very important factor going on here is that heat exposure is deadly. So there's about 725 heat-related emergency department visits that take place, according to our report that was released recently. But then there's also 13 of those that are strokes or heat stroke-related deaths. So this is really sad. And what makes me upset is that it's preventable. And so I just wanted to show this visual here just to show that it's really, there's different factors at play here, but one of them is that there is an absorption and retention, otherwise known as heat traps. And what happens is that the building materials like asphalt, concrete, brick, dark roofs, and pavement, that all plays a factor into how high the temperature goes, but also that humidity. And so it's also a talk of the importance of green space too, which we'll get into. So this is a map that you may have seen before, but just to go over it. So the darks, dark brown, dark red, okay, wait, hold on. Let me back up for a second. Everyone is exposed to heat illness, but what these colors indicate is that if you are in an area that has a brown, red, even an orange, that means that you are more likely to get sick from heat this time of year. And the yellows is you could experience heat illness depending on a multitude of factors. if like genetics or chronic condition that you may have or medication, but you're at lower risk due to other built environment factors going on as well. So with that, I think it's also important to point out that heat does not impact everyone equally. So on the left here, I like to switch up my maps and colors. So the last map was more like the yellow to brown. This one is more red, kind of like salmon color, pink. So the dark red is indicating the heat vulnerability communities that are 4 or 5. And then the lighter color of salmon is like salmon pinkish, is that you're less likely to get sick from the heat. And then what we have here, so this map to the left is from today, as we know. And on the right, this map is showing, it's a more updated version of past maps from like the 50s through the 70s through different decades, where the government used classifications to determine how to guarantee loans. And banks would use this map here where you have green areas being best land or red being hazardous or definitely declining. So the banks would use this to determine if folks were eligible for mortgages, a loan. And so this is redlining. And so it's literally like drawing boundaries around a neighborhood based on a resident's race and depriving them of like resources and opportunities, especially to gain wealth and gain land ownership and everything that comes into that. So it's an example of structural racism and how that plays into heat vulnerability that we experience today. So it's just, I like to show this map because, well, my team puts this on the data portal, but it also just showcases that there are compounding risks when it comes to climate change. That yes, this happened some time ago, but it's very relevant today, especially with health, with climate change, and with vulnerability and emergency management. So with that, we also see, just to break it down a little bit further, that yes, there's an inequitable distribution of heat risk across New York City, but even within the boroughs too. Like here, I took some examples for no particular reason. I just grabbed from different boroughs. I just compared with our data tool. We have an interactive heat vulnerability index where you can put in like the zip codes and it'll pop up one's heat vulnerability just to compare across the city. And so this is the Bronx. We have Riverdale and Tremont that are, 4.5 miles from each other, maybe a 7-minute drive. And you see these like huge discrepancies between temperature, surface temperature, right? Air conditioning ownership, green space access, medium income. But you also see it throughout Brooklyn here, Jamaica, Staten Island, even in Manhattan with East Harlem and Upper East Side. I think that's probably 1.5 miles from each other. You see such a difference going on here. So it's a big discussion about climate health equity. And so with that, hotter neighborhoods also have higher rates of pre-existing health conditions, which is what my team looks into. And with the higher rates of pollution, thinking back to the redlining map where we saw like the red areas, for instance, that's also indicating that there's infrastructure that is polluting or that there's high you say like asphalt or just infrastructure that you really don't want to live near. And so what happens as a result is like your residents are unfortunately unable to access the physical and mental benefits as well from green space, because we see here on the map from this awesome report is that you see around Central Park where even there's communities to the left that are in between like Riverside Park and Central Park, it's blue, which means that it's cool because trees can make a difference of up to 20 degrees, even 45, through that shading, for that cooling effect. And then we have like Mott Haven, upper like East Harlem area, more uptown, you see like red areas, orange. So that indicates that there is that high concentration of like buildings that have that reflection of the sunlight, which is like warming and creating heat traps. And which then ultimately leads to those emergency department visits that we talked about in the first slide. So going back, since I know that we're emergency managers, that's why we're here. So as we know, like an extreme heat event, it's one day where it's 100 degrees or more, 2 days where it's 95 degrees Fahrenheit or above. But I have to point out that like looking and thinking about these maps critically that we just saw, these past few slides, it really only has to be 82 degrees for one to feel that heat effect if you're in a heat vulnerability community of 4 or 5. So that could just be like, you know, that could be really any day that's 82 degrees. It could be a day in October, it could be in springtime. It doesn't necessarily just have to be a heat wave for one to be on alert of if you're experiencing heat illness. So this is just a plug, just again, bringing it back that high surface temperature, lack of green space, all of this compounds into a higher risk of heat exhaustion, stroke. Um, and yeah, another plug to sign up for Notify NYC so that one can be prepared and know when to take action, such as this lovely checklist here that I got from the CDC. Their stuff is so great. So we have here a checklist to spot heat illness to utilize when, I guess, if you're out and about and you want that kind of situational awareness, or if you want to directly ask somebody, like, are you okay? These are some 4 questions to take with you from this presentation to utilize out there. So, number 1, are they drinking enough water? Number 2, do you have access to AC? Number 3, do you know how to keep cool? Number 4, are you showing signs of heat stress? So, I'll get through like all of these questions, but I'll like bring this checklist up more so that you always remember. So this is the key differences between what is heat exhaustion and what's heat stroke. So AC is the best protection from heat, yes, especially for those who are at greatest risk of heat illness. But as we just learned from these past maps, that may not always be the case throughout New York City. So we gotta stay vigilant, really look out for each other as a community, and be there ready for, sure, the checklist, but also other resources that we have as emergency managers, as a VOED or a co-ed. So, starting from the top, working our way to the bottom. So with heat exhaustion, the key differences here is that you're going to feel like faint and dizzy versus a heat stroke. A heat stroke is what's essentially happening is that your body is like really telling you, like, I am not okay, Kat, do something about it. And so it'll start as me feeling faint. But if depending on your condition of your body or what not, like it can also come off like a throbbing headache. It's going to be more protruding because you're experiencing a stroke. With heat exhaustion, there may be more excessive sweating versus a heat stroke, depending on perhaps a chronic condition you have, your age, or a medication you may be taking. You may not show signs of sweating with a heat stroke. So that's really scary. And then with heat exhaustion, you'll show visibly pale, more clammy skin. And with heat stroke, it's going to be more feverish symptoms that it doesn't necessarily have to be on the dot 103, but just like a leveled temperature. And nausea and vomiting will also appear, but with heat stroke, it's going to be more like dramatic because, you're in a very critical condition. Yeah, and then I will point out also if like, especially with outdoor workers or if you're exercising, muscle cramps are a preliminary sign of heat exhaustion. So just beware, you want to get to a cool air conditioned place, you want to hydrate, and any of these symptoms are reasons to take action, go to the hospital, and also put a cold compress on your forehead, your neck, or even underneath your armpits as well to help the person like cool their body down. And so this whole section, again, this is from the CDC. It's great. I really like this visual because we're all at risk, and definitely older adults are absolutely at risk. But there's also other folks in the community as well that we have to keep an eye out for. And so I'm just going to go through these pretty quick since we have other speakers. So I will do my best to talk fast. I like to talk, so this will be tricky. So the number one group that are very vulnerable are people who live alone without AC in neighborhoods of 4 or 5. So thinking back to that brown and red area on the map. So they're without air conditioning and they're isolated. They don't have that network to, scream for help. So, and also like because of the heat, indoors can warm up a lot faster too, and that can present a lot of serious risk. And so the key messages for, all these groups, definitely hydrate, overhydrate, and taking cool baths throughout the day as much as you can. But also be mindful that if you're cooking, your stove or oven, it could warm up your home fast And so just, if you're able, get some ventilation so that way it's not creating like a trapped type of condition. Then the next group who are also susceptible to heat illness are folks who work inside without air conditioning. And so it's that combination of body heat, it's the outdoor temperatures, and humidity. They also may be wearing PPE that can like trap the heat close to the skin and prevent your body from cooling off and sweating. So that's why it can be dangerous. And so if you're in the heat for more than 2 hours or you're involved in like moderate work, just be mindful of your hydration. And 1 cup of water every 20 minutes will be good. But also you want to avoid alcohol and drinks with caffeine or sugar because that can dehydrate you faster. It will make you, it'll just dehydrate you faster. And then that could present like other heat exhaustion or heat stroke risks that we just saw. And then other folks who are susceptible to heat illness are outdoor workers as well, in construction, street vendors, delivery on bikes, or anybody outside. So I think the main key message here, if you know somebody, if you see somebody in that situation, like on days like today, if they feel faint or weak, you want to stop all activity. Don't work through it. Just stop, get to a cool place, let your body cool down. Of course, encourage that hydration. Don't wait till you're thirsty. And yes, avoid alcohol or liquids, wear reapply sunscreen. If possible, if tasks can be scheduled for earlier or later in the day, between 12 to 4, that could also mitigate. And wearing a brimmed hat, loose, lightweight clothes can also help as well. And infants, young children, pregnant women, and folks who are older than 65 are also at risk for heat illness. With pregnancy, it's because your body's working double to cool off yourself, but also your child. If you are a child, your body heat, it's going to warm up 2 to 3 times faster, so that can present very dangerous conditions. And also, like kids, like they're young, so they're they're not as like self-aware about their hydration. So just make sure that they're keeping up with that and ask, their childcare provider or teacher, like, are they exercising outside, and ask the teacher if they have a plan. Like, just, it's not, be that parent, ask those questions. And also with older adults, I put a separate slide because there's a lot to say here. I think with older adults, the main reason that they're very at risk, aside from like mobility constraints or chronic health conditions or medications that they may be on, it's that adjustment to temperature that is not as like quick as say somebody who's younger. And so also the prescription medications may be affecting that ability to sweat as well. And so I think like definitely that social network is going to be helpful in checking in to see how they're doing, but also if needed, encouraging them to like ask their healthcare provider, if it's a doctor, if it's a PA, if whoever it may be, on how much should they be drinking. And also with that, like come up with a plan on what to do, maybe like check in if they're at a high risk patient. So that's going to be very important. Also, cardiovascular, respiratory, mental health conditions, or take certain medications to treat these conditions. I mentioned it previously, but wait, let me bring out my book for this. Hold on. Okay, so this is serious because I guess let's start with mental health. So what's going on with, I'll just touch on anxiety and depression a little bit, is that with anxiety, it's tied to a stress response since you may not be sleeping. And so that's going to affect your overall well-being. But with that sleep deprivation, it's like if you're on antidepressants, it can affect that part of the brain that regulates heat and your ability to sweat. So you may be less aware of when it's hot. So it can also like raise the body temperature, and which can be deadly when paired with heat. So if that may be the case, it's always important to consult your doctor about like, what's right for you and what should you be mindful of during these during days like today. And just understand that like the heat may be contributing to this. And also with cardiovascular, with high blood pressure, just some examples, for instance. So the medication may be a diuretic, and so since you're peeing more, you're going to be dehydrated faster, unable to sweat. It may slow the heart rate, so that's why, like with heat, it's just going to amplify like what's already going on with your body. with diabetes, that increased heat can cause nerve damage and prevent you from sweating and cooling off. So I just like grabbed some random examples. Ultimately, like definitely consult your doctor, because with sweating, it's removing really important like salts and minerals. And so just again, I think I've said it a couple times, but I'm gonna say it again, consult your doctor and PA and your healthcare provider about like what's right for you, what's your plan, what's your plan for a loved one as well. What should you really be considering, and understand that AC is the best protection um, for during hot days like today, as well as hydration too. So yes, also like folks who are under the influence of drugs or alcohol, that can lead to poisoning and overdose. More likely, heat can play a contributing factor. And so that substance use impacts one's ability to hydrate, seek shelter from heat, leading to heat illness and death. And also, like stimulants do increase body temperature and it increases sweating. And so, just like hearing this, and thinking back to that graphic that we saw, it's like the heat is amplifying what's already going on. And that's why it's dangerous. Also, folks who are unhoused because of a lack of consistent access to AC, clean drinking water, or transportation to cooling centers. So, I know I just ran through a lot of examples, but I'm just saying this to make the point that like this is a community effort, and there are folks in New York City who are in these types of predicaments, and it's important to just think like as emergency managers, how can we prepare? How can we identify beforehand, like where are these cooling centers? Where are these cool spaces to save people's lives? So, oh yeah, I forgot about athletes. That's important too, I guess. So yes, athletes are also more likely to become dehydrated. So it's important to just limit outdoor activity, reapply sunscreen, schedule those workouts earlier or later in the day. If pace yourself, drink more water than usual, and going back, if you feel faint, weak, stop all activity. And muscle cramps can be an early sign of heat exhaustion. So going back to this checklist, number 1, are you drinking enough water? Number 2, do you have access to AC? Number 3, do you know how to keep cool? Number 4, do you show signs of heat stress? So I'm going to end with like these last 2 slides of just some considerations for event planning. So we do have some guidance around if you're planning an event and some factors to consider during the heat. And so to my understanding, there's 2 questions. And so you want to ask like, will the event take place on grass or sand? Or will it be on asphalt or cement? Because we're learning from this presentation that dark paved surfaces increase the temperature, and we're learning that if one has a chronic health condition, that can present some really dangerous conditions. And that like heat retained from the sun, it can retain itself well into the evening hours. Also, a second question to consider is like, will there be dancing, running, physical activity, or will there be water-based activities? So understand like it's summer, summer's fine. It's gonna events are gonna happen, but just understand that physical activity does increase risk of heat illness. So here's are some tips, and definitely encourage eligible community members to sign up for Heat Cooling Assistance Program. Stay hydrated, be vigilant for signs of heat illness. Think back to the different vulnerable groups I showed you. And yeah, definitely encourage hydration wherever possible, even in your tabling swag. Why not? So to summarize, pull it all together. Most heat stroke deaths occur to folks living in homes without access to AC, since we're learning that that's such a key component to staying safe and staying healthy. And it's also just important to communicate, like, and why I'm doing it now, it's important to understand who's at risk. Like, yes, we know heat wave is happening, but think about your situation. Think about your community's health. Like, are there a lot of people who have diabetes in your community? Or, are there a lot of older adults? Do I run a childcare facility? Just important questions to consider when it's a heat wave and it could present very dangerous conditions. So yeah, this is the checklist, and these are some resources, data tools, reports that I use to like put and curate this all together. So thank you for your time, for your attention, and this is my contact information. So thank you very much.
Thank you so much, Kat. Can you guys hear me?
Yes.
Great. Perfect. So can't forget the athletes. But so thank you for that. So I think this is actually a perfect segue. So we heard from Kat about ways to keep cool during the hot heat temperatures. So this is a great segue for us to bring in Chris, who's gonna also talk about additional resources. So Kat touched a little bit on cooling centers, but Chris is gonna just have a deeper dive into that section.
All right, sounds good. Thank you, Racine, for having me. Thank you, Kat, for that great lead in there. I usually try to spend a couple slides early on in my presentations, kind of skipping people with the heat health risk, but you guys do it with much more authority, and so that's great. Kat, can you stop sharing so I can share my slides? There we go.
Yeah, totally.
See how this
Sorry about
goes.
that.
No problem. Does everybody see that on my screen?
Yes.
All right, and let me go to presentation mode, and oh, that didn't work. There we go. How's that? All right. So I think most of you guys know me, Chris Pagnotta, New York City Emergency Management. I am here with a couple members of my team, Nelson, who's our primary liaison to the Hawaii community. You guys know, needs no real introduction. But new member to our team is here as well. Jocelyn Rajabali, who is the backfill for Anna McCullough's prior position, working on this portfolio. She's brand new, just started last week. So I'll be giving the presentation today while she gets up to speed, but she'll be working on the heat portfolio, cooling center operations, advanced warning system stuff. And so maybe doing this presentation next year. But looking forward to getting her up to speed. Really happy she's joining the team. And with that, let's get into the heat hazard response. Kind of skip through that. I'll cover a few different things. We base all the things that we do on the National Weather Service products and the triggers that they have. Those triggers were designed in consultation with us and with the health department to kind of match up to how heat actually affects human beings in all the way that Kat described before, to make sure that the triggers that we have, the products that the National Weather Service are issuing, all kind of align in a way that makes sense based on their effects on people. We'll talk about the triggers, objectives, and then I can field questions, conversation towards the end. So how do we define this excessive heat? The National Weather Service issues a few different products. The primary product right there in the middle of the screen is the heat advisory. This is when we really, as a city, jump into action. I think it is important to note that we have a lot of effects from heat on people outside of these triggers, but this is where we really see the ramp up of, okay, yeah, that's great. The ramp up of mortality based upon heat and where it gets more severe. So it's not that like no one can ever suffer a equal death at 89 degrees Fahrenheit or 90 degrees Fahrenheit or 92. But we really see a change when we hit 95 for 2 consecutive days or 100 to 104 for 1 day. So that's where we're really aligning when the city gears up and starts operationally, talking to each other at a more regular cadence and deploying all the tools that we have to mitigate those risks as best we can. And, as Kat said, these are risks that are ingrained in our environment. They're ingrained in our history. They're ingrained in our architecture, our economy. So it's really challenging on the day of to be responding to this hazard in a way that's meaningful. But there are things people can do at the individual level, and there's things that we can do as organizations. And that's what we're really trying to unlock at these times. And obviously it's very timely right now because we're in the middle of a heat emergency that I think at last prediction is scheduled to run through like November. It's just going on and on and on. And the longer it goes, the more dangerous it gets. And that's why we have these triggers at like, why is it 95 heat index for 2 days? Because the longer these things go on, the more dangerous they get. Well, if 2 is dangerous, 4, 6, 8, 10, like, these effects kind of compound. So we're very attuned to that. And the other thing I'll just point out is that we the use of the word heat index is very intentional. It's not just the temperature that we're concerned with. Heat index is accounting for the humidity as well, which of course affects the way the body actually fights off heat. So we're less concerned with the actual temperature than the way that people respond to temperature. And so we're aligning that way so that we can account for that humidity. So that's the National Weather Service products, and then this will look very familiar. You know, our triggers are right there in line with them. And one of the things that we're doing are objectives, strategies we have here. We're disseminating public information. Heat is a messaging emergency. You know, we don't know where all these people are going to be that are going to die. You know, we're looking at 115 per summer. That, you know, in a city of 8 million people, we don't know who they are. If we did, we would go get them out of their apartments. Like, you know, we would send the fire department, we'd break down the door and we'd pat ourselves on the back. But we don't know. We know they could be in zip codes, you know, we know where the risk is greatest, but we don't know at that individual level. So this is a convincing emergency. We have to change people's behaviors, make sure they understand the risk of the hazard, and make sure they understand what they can do. And we have to line some resources up for people that don't have as many resources in their neighborhood or readily available. That's how we're minimizing our public health impacts. And then there's a separate kind of echelon of minimizing impacts to infrastructure. You know, air conditioning only works with power. So we're going to make sure that we're doing some things that keep our grid as robust as we can. So in a messaging emergency, what tools do we have at our disposal as a city? This is what we really unlock in New York City Emergency Management. The advanced warning system is a tool that we have here within my unit. Jocelyn will be running this one. You might have seen the messages come out this week about the heat event that's currently going on. We send these, you know, this is an effort to reach service provider organizations. We also notify NYC. This is like more of our retail emergency product where any individual in the city can sign up for alerts and they get alerts that are tailored to them. It could be their subway line, outages. It could be whole, you know, hazards that affect the whole city. But you can kind of like pick and choose like what you're most interested in. And then we'll have also kind of an overriding thing about like, hey, this is what you really need to know about. We're also, you know, doing more traditional press outreach. Our commissioner is on TV. The mayor is on TV. We're lining up the health department commissioner to speak at this event, that event, and just finding different ways to kind of punch through and capture people's attention to make sure they understand that like, hey, you know, you're 70 years old, you've lived through heat waves for 70 years. Congratulations. Like you've earned the right to feel good about that, but you're in a different kind of risk scenario now. We want you to understand that like, you know, you've never lived through one as a 70-year-old before, and that things are changing. So we're really exercising every lever that we can to kind of punch through and deliver that message. And the way we talk to people is really critical. I mentioned the advanced warning system. So we have kind of two tiers of this. The first tier is the messages that we send out through our alert system. This is text messages and emails that go out, amplifying press releases, also doing some more kind of tailored to service provider messaging on occasion as well. More than 6,000 individuals representing over 2,000 organizations are on there. I'm sure that a great many of you subscribe to these alerts. If any of you don't, then I accept that as my failure for having failed to convince you. Please do subscribe to these alerts. You guys are exactly the people that we want to make sure that we're reaching with this tool. Because you have relationships either to clients directly, to other organizations that are reaching clients, and you're reaching them in a different voice. You know, this is a tool that exists because we recognize that like, while we would love, you know, trotting my commissioner and Kat's commissioner out there in front of a camera, everyone's going to be like, they're experts. They know it. Like, let's do what they say. But there's some skepticism and trust in government issues that we have, and we want to account for that. And we want to talk to people, you know, utilizing all our relationships and a myriad of voices so that people get information that's trustworthy from a lot of people that they hear from. And that's you guys. We also hold AWS calls with umbrella organizations. These are large, you know, city agencies, nonprofit providers that, you know, generally reach large groups of people. So like Department of Homeless Services, Department of Social Services, Department of Health, you know, organizations that have lots of different service providers kind of under their umbrella, as well as some of the larger nonprofits or state organizations, visiting nurse service, end-stage renal disease, so that we've got like, you know, all the dialysis providers that we're talking to. So we'll hold conference calls with them. usually at the outset of a heat emergency. And then for ones like this, we'll have an extra one kind of halfway through the emergency to be like, hey guys, we already talked about what we're doing. You've already reported out. Like, what else can we do? Are we sure we haven't missed anything? Just to have that extra check to make sure that we're pulling every lever that we can. And it's these, like, again, these current heat waves that are the really scary ones. We talked about the cooling center program a little bit before. There's no magic to cooling centers. These are not generally standalone sites. It's not like a tent that we drop down in the middle of the city, set up industrial air conditioners, and, like, you know, create a meat locker in Times Square. That's not the program, and nobody really wants to go to that kind of thing. But these are like places that are generally already open. So we're talking about like libraries, older adult centers, senior centers, recreation programs. You know, the Salvation Army helps out with a bunch of their temple core buildings and places that regularly function as super kitchens, to accept people. Any building with air conditioning will generally do. The ones that people are most interested in going to are the ones that have some kind of pre-existing programming and already serve an at-risk population. You know, like, I love all our cooling center partners, but got to admit that, you know, Department for the Aging's older adult centers are uniquely situated for this hazard. They're serving a high-risk population, people that are old, you know, and they're generally serving, you know, some lower income people. A lot of people come for the free lunch that they get on a daily basis, and they're building up, you know, social networks inside those places and getting access to programming that they're actually interested in. An older adult center in Spanish Harlem looks very different than one in Borough Park. They have different programming. They have people speaking, you know, and practicing activities that are attuned to their cultural preferences. So that's fantastic. We've got a ton of them throughout the city, like over 260 or so. Everyone's, you know, like, with all these providers, air conditioning does go out, and we take them off our cooling center map when the air conditioning goes out. And so we're always contending with that. And when you've got over 600, you know, facility partners, you're going to find at any given time, you've got, you know, 10% that are out. Even if an air conditioner only goes out every 10 or 20 years, when you've got this many, you're going to have a big chunk of them that are out on any given day in a heat activation. And they tend to die when it gets really hot, which is a bummer. But we, you know, we try to fight it with numbers, and we try to fight it with a variety of different partners. We're actively recruiting new partners and trying to reimagine, you know, who can participate in this program. We've got a partnership with Petco, so pet owners can come in and get relief for themselves and their pets. That's always been a challenge for us in New York, is finding places that are pet friendly. We're reaching out to museums, other programs, offices of elected officials. We're really turning over every stone that we can to find the places that can serve this role in as many New York City communities as we can. And we've recognized that, like, you know, libraries are generally closed on Sunday. We got a bunch of them back for this year with some budget maneuvering, but you know, kind of lost in that the headlines and that press fight for that budget was that most of those libraries still are closed for Sundays. You know, it's only a handful citywide that are open on the library side. We do have the ability to open up a large number of our older adult centers. Sunday operations and cooling center operations are now written into their contracts that they'll open up. If we don't get a forecast that gives us an assurance that we're going to have the trigger on the Sunday, it can be harder to get those up. You know, these are small nonprofit providers. They're not super nimble about, like, getting a phone call on Saturday and lining up a staffing pattern for the following day. So we really try to make our decisions early on Friday mornings if we're going to activate on a Sunday, and with that very much in mind. And it's kind of, you know, inside baseball for emergency managers. Around here, we're super busy. Thursday night, Friday mornings, talking to decision makers, looking at that forecast, trying to, like, you know, tease out the signal from the noise of, like, you know, what's actually going to happen in a couple of days. What can we do about it now, even in the absence of great information? So that's the cooling center program. We do on occasion do the thing where, like, we open up a place that doesn't normally open to the public, and set up a flag as a cooling center. The buildings that we have that are air conditioned in greatest prevalence in New York City, widely distributed across neighborhoods, is schools. We open those up. We've been opening them up for this past heat wave. We will pull that tool. We want to make sure we have credible options. The first ones we open up are always in those heat vulnerable neighborhoods where we've got just less providers in general. We have a higher heat risk, lower air conditioning penetration in those communities. So we will open those up. We will make them available, but we also know they get visited a lot less. So, while we're, proud of the fact that we can, as emergency managers, pull that trigger and take that action, we're also cognizant of the fact that it does not replace that older adult center. It does not replace that library, and people, there's less to do. I can turn the air conditioning on in the library. I can have the school safety officer come in and the custodian. But you're sitting in the library with nothing to do. And the visitorship shows that. So it's a tool that we will do, especially in heat waves like this. But it is a little bit less effective. So with that in mind, this is this slide here is actually from a couple of years ago. We have over 600 centers currently. I'm not sure what the current amount open is today. We made some enhancements to our public-facing map as well, so that regardless of whether we are in a heat wave or not, you can see the places that are generally available and open that day. So outside of a heat wave, those libraries, older adult centers, they're already open to their clients. So we keep them on the map. During the heat wave, like we are right now, we add additional sites. So the places you normally can't get in, like youth and community development is running youth programs. I'm not welcome in there on a day it's not a heat emergency, but on a heat emergency, they become a cooling center and they'll carve out a space in their program and prepare for visitors. So they'll do that. And those places will appear during the heat wave. So the easiest message is that you can always go on the map and see what's available. You should always call ahead. And you should know that when it gets really hot, we hit our triggers, we're going to open up additional places beyond what you see when you're not in the heat wave. I think I talked most of this stuff already. The bottom right is a view of our cooling center map. Again, that's an old picture. Don't trust that every one of those dots is going to be there today. Most of them will be pretty much the same because the facilities don't move around that much. But we're pushing to add as many as we can. Other efforts to minimize public health, another at-risk population, homeless individuals in New York. Department of Homeless Services does have these protocols that they kick into gear when we hit these heat emergencies. Code red, there's 2 levels based upon the trigger, and the difference between what they're doing in code red level 1 and level 2 is the frequency of the outreach. So they track known at-risk clients, people that they see in the street every day that they can't regularly convince to come inside, and they make sure they check on them more. So there's a given amount of contacts that they try to make in code red level 1, and then they increase the frequency of those contacts at code red level 2. Trying to get them to come inside, they'll take them to a cooling center, they'll try to get them placed for housing if they possibly can. And if they're not going to take any of that, they'll try to offer some water, or at least convince them to come into a coffee shop for a bit and get a little bit of temporary relief. But keep an eye on that. And then there's other things that come with code red level as well, where shelters are not discharging people, and we work with the hospitals too on their discharge policies, and when they have unhoused clients in their emergency rooms to be more lenient about letting them stay around in the emergency room where it's or in a waiting room where they have air conditioning. Minimizing impacts like public health continued. The Home Energy Assistance Program, this is a state program administered locally by DSS, helping low-income New Yorkers afford air conditioning. It doesn't pay for the utility bill, unfortunately, but it'll get air conditioners installed. We did some additional work during the pandemic with a city-led effort to provide air conditioners, install something like 20 or 25,000. Don't quote me on that. Air conditioners. During the pandemic, because we knew we didn't have cooling centers available as well, because a congregate cooling strategy is not great in a pandemic. So all of this requires air conditioning though, and we need power for air conditioning. The grid is at, its maximum kind of level during these heat events. So we're doing appeals to large corporate customers of utilities to dial back their cooling, dial back their energy use in any ways they can. to make sure we're relieving some of that stress on the grid. I'm not really an expert in this part of it. We have a critical infrastructure unit that works on these products and works with utilities, but these appeals, these load management, demand response, all just ways to say, like, how do we kind of manage our use of energy on the grid through especially our largest customers. Excavation safety alerts, another one that's really interesting. We're a city that's always under construction. There's a construction shed on every other block that you cross. Sometimes that construction involves digging. Sometimes that digging involves digging near underground infrastructure like utilities. We never want a contractor to hit those lines and cause an outage. But during a heat event, we're especially in tune with it. And the rules about how close you can get to that infrastructure changes when we get into these heat events, to make sure that we're not taking any risk that we don't want to during an event like this. We'd hate to have a contractor working somewhere, hit a line and cut out power to a neighborhood, including people that are on life-sustaining equipment. So we try to keep an eye on that. Spray caps, I think of this always in terms of the movie Do the Right Thing. It's classic New York street scene. Kids love to play in fire hydrant in New York City. Awesome, iconic New York City. But if you just open up the fire hydrant, it dumps a ton of water on the street, and really causes a loss of pressure. Firefighters like to have those hydrants working to put fires out. People whose houses on fire also like that. They generally want those fires to go out. So there's this cool program where you can go down to a firehouse and you say, hey, give me a spray, can I please have a spray cap? And the spray cap will attach to the hydrant, as you see here. It allows some water to escape in a sprinkler-like pattern, but really saves a lot of water pressure, and saves a lot of water. And you can see there that the hydrant spray cap reduces the discharge from 1,000 gallons a minute to 25 gallons a minute. It's wildly dramatic. Neighborhoods that are at elevation are particularly vulnerable to this loss of water pressure. So if you live up in Washington Heights, and you've got 4 or 5 open hydrants that are dumping water on the street, and then the fire department shows up to put out a fire, there's just not as much pressure at that elevation because it's closer to the height of the reservoir level, to get the water out of that hydrant and onto the fire. So this is cool. You can go down to a fire hydrant, get a spray cap. I talked before about keeping in touch. Please, 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 everybody in the call, subscribe to Advanced Warning System. Notify NYC too, but you guys are service providers, and we really want to be able to keep in touch with you that way. The Beat the Heat URL right there kind of unlocks the keys to the kingdom for New York City heat response. You'll find your cooling center map up there as well. Here's the links for registering for alerts, Advanced Warning System NYC, additional heat tips. There's a great parks map with where you can find pools and green space in the city for less acute heat emergency tune cooling, but more great recreational cooling. We're hoping to do a build in this off season, which will incorporate kind of all of these things together as a full look at all of New York City's answers to climate risk. So you could get cooling centers in the map with layers for parks, pools, beaches, stuff like that. That's a coming next summer thing. It's going to be a big build for us because it involves pulling in a lot of different data streams into one place. If anybody knows of organizations that can serve as cooling centers, we'd love to know about it. The Share Your Safe Space survey is how we can find out about it. We try to make this really easy for partners. Free, open to the public, air conditioning, drinking water upon request. It doesn't mean it has to be like out on tables, served a la carte. But if somebody says, hey, can I get a glass of water? We'd like to give them one. And it's got to be open during daytime hours, peak heat. Regular operating places where they already have doors open, you don't have to line up staffing is best. But we're willing to work with partners and kind of test our operational models to get a good partner on board as well. And that's it. That's my show. I hope I didn't run too long. I'm willing to answer questions, Racine. I know you've got another presenter to go, and I'm sorry. It looks like we're Yeah, 10
No,
minutes
no
left.
worries. Thanks so much, Chris. Just if we could just hold, just because we have Caleb coming up next, and
Yep.
I'm gonna make sure we give him ample time. But Caleb, if we could just jump in, and if there's any questions or question Q&As, please put it in the chat, and as you can see, I'm putting messages in there. But Caleb will be discussing with us on advocacy and awareness. So we heard about resources available and how to keep cool tips, but now Caleb is going to show the work that's being done for environmental justice. So Caleb, please take it away.
All right. Hi, everyone. Thanks so much. I'm gonna go ahead and share my screen. Um, so, oop, okay. All right. So I'll try to be quick because I also have a conflict at 11. So I'll try to move through this quickly. So I'm the resiliency coordinator at We Act for Environmental Justice. I'm sure folks know We Act has been active in Harlem since 1988, really working to empower communities to engage in the creation of sound and fair environmental policy and practices for healthier communities. So really quickly, I just wanted to also briefly talk about the Extreme Heat Coalition. I'm the lead facilitator of this coalition, and since launching last year, we've grown to about a dozen orgs, and we also have some individual contributors, including Dr. Kim Knowlton, who worked on the New York City panel for climate change, the most recent release. This work has come out of our Heat, Health, and Equity campaign that started in 2019. And it really was something that became high priority for us, as there's a very clear racial divide in who dies from extreme heat. Black New Yorkers die at 2 times the rate of their white counterparts. And this is also a pivotal step in our LIHEAP advocacy as well, which I'll touch on a little bit later. And so all of these organizations we band together with in order to make sure that the most heat vulnerable residents subject to the urban heat island effect are really represented and considered when it comes to both city and state adaptation and mitigation policy. So Chris was really thorough in the cooling center overview, and I learned some things. I actually have some questions that I need to follow up about. But so Chris mentioned kind of a lot of upgrades and changes to the cooling center program. It was really exciting to see with the new cool options map that's now available 24/7, which previously was only available when there was a heat advisory announced. But there are still some challenges that we think cannot be solved without funding for the program. So a couple years ago, members of the Act Climate Justice Working Group did an audit and report of their experience in cooling centers, and some things that community members wanted to see more of were targeted outreach in their neighborhoods, more programming, like Chris mentioned, like libraries are definitely much more popular, and senior centers, because they already have that service model included. But it's something that, in order for cooling centers to not be considered an inconvenient detour, they need to be tailored to the needs of community members. So that's another piece. And also making sure that staff gets training on heat health safety and can recognize and interrupt the symptoms of heat-related illness when they see it, and also improve the adaptation capacity of community members through that sort of education available on site. And then there also are a number of things that can be done to set like a clear baseline as to, you know, what services are available, amenities, and also extended hours, whether on the weekend or in the evenings, especially not getting relief from the heat in the evening times can have really detrimental knock-on health effects that are often unsung. And yeah, I'm just trying to breathe through. So I'm like really going over my notes quickly. But there's also not really a good way for community members to discuss like, you know, their attendance or their experience in cooling centers. So funding for that as well is something that we want to see. And previously there was a cooling center bill introduced in 2019. WEAC is working to have that reintroduced so that, you know, these things like program longevity, outreach, and barriers to access, all these things that I've highlighted here in the slide, can be something that we address in the charter and allocate funding for the program, so that it's not subject to political whims and being cut in the long term, because we know that it's consistently going to get hotter year over year. So that's one of the things that's been on our agenda. We are also looking to introduce an indoor maximum temperature law. If folks heard about our extreme heat policy agenda webinar, I guess at the beginning of June, Lincoln Ressler joined and announced that he would be introducing the bill. So this is really designed to make sure that the burden of cooling doesn't fall solely on tenants, because we have in our building code requirements for heating. So we recognize that temperature control is essential to safe and quality housing, but we don't have anything like that for now, the extreme heat that we're enduring year over year. So this is really meant to require landlords to offer some of that, and also provide additional support to make sure that air conditioning is installed in the most energy efficient manner, to reduce the burden on our grid and deliver cooling more quickly to the most vulnerable tenants, and make sure that folks know that they have this right and are aware of heat health safety. One thing that I want to flag briefly here is that with the introduction of a city level law, we'll be pursuing additional legislation at the state level to help reduce the cost burden that comes with cooling, because as Pat mentioned, a majority of the deaths, heat-related mortality that happen are in households that don't have air conditioning or are not running their air conditioning because they can't afford it. So that's a really crucial piece to make sure that this is an effective bill. I wanted to really briefly go into the Extreme Heat Action Plan. I think folks are probably familiar with this, but the Extreme Heat Action Plan was something that took nearly 2 years of input from community-based organizations, private sector, and academic researchers concerned about health and social and economic impact of excessive heat, coordinated by NYSERDA and DEC. The state has organized strategies it has been recommended to take into action tracks depicted in this image. and I'll try to quickly go over how our advocacy interacts with these different action tracks. So really quickly, I wanted to talk about, oh, oops, this has the wrong note. Well, oh, okay, sorry, there's a typo here. But one thing that we've been working on is getting the TEMP Act passed, the Temperature Extreme Mitigation Plan. It did not pass this year at the state, but it was introduced by Senator Ramos and had a number of provisions to make sure that workers in the car wash industry, construction, delivery, agriculture, and food service all had these protections covered. And originally it did have cold stress covered as well, but it towards the end it just switched to heat stress protection. But what's really important about this, aside from the sorry, to rewind, the state is looking to address protecting workers' heat and health through engagement with local partners and focused outreach initiatives. So that includes working with local governments through the Department of Health and identifying service gaps and best practices for outreach, and the Department of Labor and partnering with labor unions. But the TEMP Act would really be like a legislative action to get protection to everyone by mandate, simply for the fact that there are a lot of folks that fall outside of labor unions that are in these really impacted neighborhoods and need the whistleblower protection. And while the Department of Labor would also support with worker education and multilingual signage that's denoted here, we just need much broader and more robust protections around worker safety. Around the built environment, infrastructure, and managed spaces track, affordable cooling is a major part of it. One of the biggest and most arduous parts of our advocacy is getting more funding for the LIHEAP program. Chris mentioned that currently it can only be used to get air conditioners installed, but we really want to see it applied to the utility costs that are incurred in the summer. Again, if people can't run their air conditioning, we're not really getting to the root cause of the issue. And then we're also engaged on the New Efficiency New York initiative, and advocating for streamlined access to energy efficiency programs. And for folks who aren't familiar, the New Efficiency New York program is really designed to make sure the state hits its energy efficiency goal of saving 185 TBTU by next year. And it's an initiative that is subject to the Climate Leadership Community Protection Act equity mandate of making sure 35 to 40% of energy investments directly serve disadvantaged communities. But low to moderate income households historically, or at least so far in the initiative, really have lost out and on their share for a number of reasons, including the systemic disinvestment from redlining, like Kat mentioned, and barriers to home ownership. And so we're trying to make sure that even things as simple as the application process aren't putting unnecessary time and administrative labor, which also results in extra costs to benefit from these energy efficiency programs. are addressed. And then also another multi-year sort of policy goal that we listed in our extreme heat policy agenda was amending the warranty of habitability to include cooling with housing. So this is at the statewide level, making sure that there is a requirement for cooling in housing, which would also shelter the like any sort of why am I drawing a blank on the word? Revisions. Oh, sorry. Were you gonna say something? Racine. Okay, never mind. That when housing needs to undergo improvements to include cooling, that then an individual apartment increase or major capital improvement increase won't displace residents in need of cooling, because it's something that is just to meet the baseline requirement of housing statewide. And it also makes sure that like every city doesn't have to undergo the process of like legal protections for cooling. Yeah, I'll move on here. And then
I'm sorry to interrupt. So I think that if we can just
oh geez.
yeah, I want to be mindful of your time, just because I know you said you had an 11 o'clock that you had to go for, but I think that this information is so important, and I think that it deserves its own attention because it has a lot of information. So if we can work offline and set up another time where we can just maybe do a special discussion where we can talk about this, and then we can give it the time it deserves. What do you think about that?
Yeah, I mean, this was really my last slide. I guess to be brief, just on this sort of action track item, this really comes down to monitoring of Bond Act implementation and engaging with public comments and the guidelines for different programs, as well as our thriving communities, technical assistance centers, supporting organizations to access grant funding. I'll leave it there. I didn't realize that
No, it's not
went
your
on
fault
so
at
fast,
all.
but,
We just went over.
all right. Well, thanks again for the time here. I'll also send some information. I had to skip over the slide, but there's also a webinar that I'm co-hosting next week on the CDC Heat Health Initiative, which goes over a bunch of heat risk tools with the designers of the tool and American Public Health Association and National League of Cities. So I can send information about that. But I'll stop talking now.
No worries. And I apologize for not being more diligent with the time, but I thank you so much. I think this information is so helpful, and I think that we should open it up more to the network. So let's talk offline about how we want to set that up. But thank you, everyone. I know we're at time and those have to hop off. Thank you so much, Caleb, Chris, and Kate for Kat for joining us today and presenting for us. It's been so informative, and if you can also share your slides with us. I've been getting a lot of messages on the side where members have been asking if that's going to be shared. So I'm happy to email that out to the group. But thank you, everyone, for joining us, and we will see you next month. Take care.
Thank you so much. Take care, everyone.